This video could save your stomach. If you often feel abdominal pain, bloating, acid reflux, or nausea, and you can't stop burping or belching, if you're even losing weight for no reason, please leave a message in the bullet comments or the comment section. These could be signs of early-stage stomach cancer. I know that sounds alarming, but don't panic just yet, because these could also be symptoms of chronic gastritis, stomach ulcers, or gastroesophageal reflux protesting. In recent years, due to staying up late and chronic stress, irregular eating habits like sometimes starving and sometimes binging, the habit of eating food that's too hot or too salty, and Helicobacter pylori infection, young people and their stomachs have long been tormented to the point of exhaustion. So in this episode, we want to guide all you food lovers to understand how to differentiate between common stomach ailments and early-stage stomach cancer, learn truly scientific ways to care for your stomach, and find effective measures to relieve discomfort. Let's uncover the truth about stomach diseases together. One, chronic gastritis versus early-stage stomach cancer. Here's a harsh truth. Whether it's early-stage stomach cancer or chronic gastritis, both can cause stomach discomfort like abdominal pain, bloating, belching, nausea, acid reflux, and vomiting. And here's an even harsher truth. Whether it's early-stage stomach cancer or chronic gastritis, patients often don't feel any symptoms at all. In other words, based on feelings alone, we can't effectively distinguish between the two. So how can we tell them apart? 2 words: a gastroscopy. If early-stage stomach cancer can be detected in time and treated proactively, the 5-year survival rate can be over 90%. But unfortunately, the early diagnosis and treatment rate for stomach cancer in our country is less than 10%. And the clinical outcome for stomach cancer treatment is closely related to how early it's diagnosed. The effectiveness of treatment is closely related to how early it's diagnosed. Closely related. Most patients are already in the advanced stages when they're diagnosed. This results in a 5-year survival rate of around 35% for patients. However, in Japan, where the incidence of stomach cancer is also very high, gastroscopy screening is much more common. The overall survival rate for stomach cancer patients there exceeds 60%. So here, I need to emphasize to everyone once again the importance of gastroscopy screening. If you are 40 years old or older and meet any of the following conditions, it is recommended that you get screened for stomach cancer whether you have symptoms or not. 1. You live long-term in a high-risk area for stomach cancer, such as the provinces of Shandong, Jiangsu, Liaoning, Fujian, Gansu, and so on. 2. You have a Helicobacter pylori infection. 3. You have a history of precancerous conditions like chronic atrophic gastritis, gastric ulcers, gastric polyps, remnant stomach after surgery, hypertrophic gastritis, or pernicious anemia. 4. A first-degree relative has a history of stomach cancer. 5. You have other high-risk factors for stomach cancer, like a high-salt or cured food diet, smoking, or heavy drinking. We've also put the specific details into a chart, so you can easily screenshot it for reference. 2. Gastric ulcers. As the name suggests, this is when an ulcer appears on the stomach wall. Compared to chronic gastritis, the lesion is no longer just on the surface of the gastric mucosa. Instead, it penetrates the muscularis mucosa and reaches deeper layers. The classic symptom is upper abdominal pain. It might be a dull ache, a burning pain, a bloating pain, or a hunger-like discomfort. It can last for several years. The flare-ups are often recurrent or cyclical. The pain is also often related to when you eat, either starting or subsiding, because some patients have atypical flare-ups. The gold standard for diagnosing a gastric ulcer is still a gastroscopy and biopsy. However, when a gastric ulcer develops into an acute gastric perforation, you won't need a gastroscopy because you will feel it. A sudden knife-like excruciating pain in your upper abdomen. Compared to chronic gastritis, the lesion is no longer just on the surface of the gastric mucosa. Instead, it penetrates the muscularis mucosa and reaches deeper layers. The classic symptom is upper abdominal pain. It might be a dull ache, a burning pain, a bloating pain, or a hunger-like discomfort, and quickly spreads throughout the whole abdomen. The patient's face will be pale and they'll break out in a cold sweat. It's often accompanied by nausea and vomiting. When this happens, what you need to do is rush to the emergency room to save your life. 3. Gastroesophageal reflux. Gastroesophageal reflux. As the name suggests, it refers to when the contents of the stomach or duodenum flow back into the esophagus. The typical symptoms are reflux and a burning pain behind the breastbone. In other words, what everyone calls heartburn. It usually happens or gets worse after a meal, when you're lying down, or when you bend over. So what can we do to deal with these stomach problems and prevent stomach cancer? First, let's talk about taking care of your stomach scientifically. Now, for many people, the first thing that comes to mind for stomach care is to eat a lot of plain congee, but that's not quite right. While it's true that plain congee is easier to digest when your stomach is upset, it also flows back up much more easily than solid food. This is especially true for people who have symptoms of acid reflux and heartburn. Liquid congee is actually harder for your stomach to hold down than solid rice. The older generation loves to eat their congee piping hot, and we've stressed this many times. Hot drinks over 65 degrees Celsius have been classified as a Group 2A carcinogen, meaning they increase the risk of getting esophageal cancer. So what does real scientific stomach care actually involve? One, cut down on salt and alcohol. When your body takes in too much salt, it can damage and weaken the lining of your stomach, increasing the risk of gastritis and stomach cancer. Two, don't smoke. Smoking doesn't just cause lung cancer. There are thousands of harmful chemicals in tobacco. A comprehensive analysis of 95 global studies conducted up to the year 2020 showed that, compared to people who have never smoked, the risk of developing stomach cancer for current smokers is 61% higher. 3, limit your intake of fried barbecued, pickled and smoked foods. First, let's talk about taking care of your stomach scientifically. For many people, the first thing that comes to mind for stomach care is to eat a lot of plain congee. But that's not quite right. While it's true that plain congee is easier to digest when you have gastrointestinal discomfort, pickled foods aren't just packed with salt. They also tend to produce a type of carcinogen called nitrosamine compounds. And when food is grilled or fried, other carcinogens like benzopyrene can easily form. Of course, we know many of you are incurable snackers. So what are some things we can eat more of? First, you can get plenty of fresh fruits and vegetables. Second, you can get plenty of exercise, plenty of fresh produce, and plenty of exercise. Not only lower your risk of cancer, but also reduce the risk of high blood pressure, diabetes, cardiovascular and cerebrovascular diseases, and many other conditions. Talk about a win-win. Besides taking care of your stomach with a science-backed approach, eradicating H. pylori is another crucial intervention. Helicobacter pylori is a major risk factor for many stomach ailments like gastritis, stomach cancer, and peptic ulcers. So whether you're preventing or treating stomach problems, for anyone who's H. pylori positive, getting rid of the bacteria is a critical step. In China, a staggering 700 million people are infected with H. pylori. The earlier you eradicate it, the greater the benefits. The current standard treatment is called quadruple therapy. This refers to a combination treatment using 2 types of antibiotics, 1 proton pump inhibitor and 1 bismuth agent, a combination treatment. The antibiotics go in there and just go on a rampage. The bismuth agent is there to protect your stomach lining, and it even has some bacteria-killing properties of its own. The proton pump inhibitor effectively reduces stomach acid, which helps the antibiotics do their job better. You typically need to take these for 14 days. The eradication rate is over 80%. Now here's something very important. Whatever you do, don't just stop taking the medicine. You have to strictly follow the dosage and schedule and take it continuously. If you don't, it will compromise the treatment's effectiveness, and you could even develop antibiotic resistance. So you must follow your doctor's orders and complete the entire course of treatment. Got it. Stopping and starting your medication is like putting bacteria through a drug resistance boot camp. The stronger their resistance, the harder they are to eradicate. If you frequently experience bloating and indigestion, acid reflux, heartburn, and other symptoms of gastritis or gastric ulcers, or gastroesophageal reflux disease, first pay close attention to your habits like drinking alcohol and eating spicy food. These often make the symptoms I mentioned worse. Second, after a clinical evaluation and under your doctor's guidance, you can use certain medications that suppress stomach acid secretion, protect the stomach lining, or promote gastrointestinal motility. For instance, dashprazole drugs like rabeprazole and iloprozole are common medications used to suppress stomach acid secretion. They can lower the acidity in your stomach and reduce irritation to your stomach lining. This helps relieve symptoms associated with conditions like gastroesophageal reflux. Gastric mucosal protectants like bismuth potassium citrate, as the name suggests, are used to protect the stomach lining. They generally need to be taken before a meal. So why do you have to take them before eating? That's because when your stomach wall is damaged, bismuth agents are hardly absorbed. Instead, they quickly settle onto the damaged surface and basically paint a protective coating over it. This protective film can shield the damaged mucosa from the corrosive effects of stomach acid and food. They're often used for chronic gastritis and to relieve stomach pain caused by too much stomach acid, as well as symptoms of heartburn and acid reflux. Then there are the prokinetic or GI motility drugs. Drugs like mosapride can promote gastric emptying, which improves symptoms caused by insufficient stomach motility, such as belching and bloating. But beyond knowing the drugs that can help relieve our stomach discomfort, it's even more important to know which drugs are bad friends to your stomach. NSAIDs, or non-steroidal anti-inflammatory drugs like aspirin and ibuprofen, can potentially cause damage to the gastric mucosa. If taken with alcohol, they will cause even greater harm to your stomach lining. So when taking these drugs, you must not only avoid alcohol. If you need to take them long-term, the damage to the stomach lining will be even worse. So, while on these medications, it's not just about avoiding alcohol. If you're on them long term, the damage from combining them with alcohol is especially severe. Or taking it in large doses. You should have a thorough discussion with your doctor. Now, after hearing all this, I bet some of you who usually have a cast iron stomach might already be feeling some discomfort or even a dull ache in your stomach. Don't panic, because anxiety itself can also activate your sympathetic nervous system, affecting the movement of your gastrointestinal tract. Then indigestion, bloating, and other functional gastrointestinal disorders will pop up and start making a scene. So I need to reassure you all about something. Going from common chronic gastritis to the final boss, stomach cancer, takes a lot of bad luck and a long time. You don't need to scare yourself into sleepless nights. After all, anxiety is one of the main culprits that harms the stomach. So here's our advice. For those of you who fit the criteria, if you need to get rid of H. pylori, then do it. If you need a gastroscopy, don't put it off. But you should also be clear that for the vast majority of you, the report you'll get will be a scary, but ultimately harmless one. What we're trying to do, based on current evidence-based medicine, is simply to lower your risk as much as possible, right? Get screened early. Eradicate H. pylori and take care of your stomach scientifically. Let's make sure that while we're enjoying our meals every day, we also win this battle to protect our stomachs. All right, that's all the content for this video. If you feel this was somewhat interesting or helpful to you, please follow us so you can learn even more about medicine.